when you talk about these group homes, they're not the best places for people with mental illnesses at times.
For child welfare prevention, I can't say enough about how important preventative work is. That if we're really imagining a new child welfare system, it would be one that didn't exist at all. Because we have resources and supports in place from infancy, and that we as a community are aware of how we can be mandated supporters and not mandated reporters, that we are all partnering with youth and families in every single setting that a family touches.
As we have spent a lot of time and a lot of years really working on reducing the population of young people in foster care, that we've been able to accomplish that because of the prevention services that we've developed and that we've put into place here in New Jersey over the last 10 years, as well as the development of the behavioral health services and the supports that are available, to children in community.
If I were going to summarize a few things that the child welfare system should be doing to support young people in their mental health, I think the first thing is leaning into young people's expertise.
One of the first things would be we have to listen to the families. That's the biggest thing. If we don't listen to them, then we'll never know what's going on with them. If we don't give them a voice, then we'll never know how to help them.
Responsive practices that I've seen that have proven successful and have moved us to higher levels of engagement with youth and families. And I think what moved me to higher levels of engagement with my own youth and family has been specifically the different levels of support groups. So really culturally responsive support groups.
I think one of the biggest sort of healing-centered, culturally responsive supports that we also, again, have consistently heard from young people is really helpful is peer support. And peer support looks like other people with similar or shared life experiences that are now helping the next set of folks along their way.
I would say the most important thing that child welfare leaders can do is work with their Medicaid agencies to reform the definition of medical necessity as defined by removing diagnosis as a prerequisite for care, by expanding the provider class, bringing more culturally concordant and culturally relevant sub-licensed or unlicensed staff onto treatment teams, and to dramatically expanding the access and availability of care by spending more money. So for me, that means dramatically expanding high fidelity RAP. Like when you talk to child welfare systems and mental health systems, there's a universal consensus that the most effective thing we can do for young people is to give them a high fidelity wraparound program.
Any family in the state can call our 1-800 number for and access behavioral health services, whether that's, their child is currently in crisis and they're looking to access mobile response services. We have mobile response services in all 21 counties in the state. And, within an hour of making that phone call, we can have a mobile response counselor out to a family's home, to a school, to a fast food restaurant, wherever the family is, where the child is in crisis or needing support, mobile response can respond.
We've heard a lot about a desire to receive mental health support via technology. So a big piece of our advocacy at CLASP is about trying to figure out how we can increase access and get mental health services provided via text and app reimbursed by Medicaid and by other insurances.
We can't just push them on the back burner because we think there's a mental health thing that's going on. Most of these kids, the mental health is that they've been removed from the people they love. And it is not their fault. And we got to let them know that it's not their fault. But we got to make sure we do everything in our power to make sure that these kids get back home to their parents or their loved ones.
We have struggled to build healing-centered residential placements for children in child welfare. And there's a number of reasons for this, but what we've learned mostly is that young people need to heal in relationship, and those relationships need to be carefully protected. And that when multiple young people are healing at the same time, at different stages, it becomes incredibly difficult to manage and support those healing journeys. So the smaller increment of healing, the better. While it looks similar across the trajectory, it's unique at every stage in the process. So the best, when young people need residential treatment, it should be very short term. It should be in extremely small facilities, like 2 to 4 bed max. And it should be with heavily staffed and deeply embedded family systems work, meaning it should happen only in and with the family of origin that the child will be returning to.
One thing I think is important to know in the child welfare system is that there is not one size fits all. So we have to really, if you really care about these kids, you really have to show them, and we have to build from there. So what one kid may need, another kid may not need. So we have to really just we're investing in individuals, not a system. So we need to change that around.